Let's talk about health disparities.
Health disparities are the differences in incidence, prevalence, mortality, and morbidity of disease and other health conditions within specific, often disadvantaged groups that are unavoidable, unnecessary, and unjust. Factors can include environmental threats and individual behaviors. However, all differences must be related to social justice by demonstrating a distinction between advantaged and disadvantaged groups.
Health disparities affect mostly the minority groups. For example, the Latinx, Black Americans, and the other groups listed on the slide. Health disparities affect each group at different rates. In case of cancer screening, Black Americans have higher death rates and incidence than any other race. The factor affecting this is the lack of access to healthcare, which leads to late diagnosis, and other lifestyle habits like diet, smoking, and nutrition.
Solutions to health disparities are not simple. Solutions for a particular group might not work for another, and they must keep in mind cultural and social differences, as well as actively be anti-racist and intersectional. Examples of federal programs include the multiple departments under the Department of Health and Human Services that are dedicated to addressing racial and ethnic disparities in healthcare. For example, the Office of Minority Health has programs such as the CCCHP, which help ensure that healthcare that is culturally and linguistically appropriate is provided. Examples of local programs include the Great Smoky Mountain Study, which initially provided income supplements to the Cherokee in 11 counties within western North Carolina. Another example would be urban planning and community development, whose goal is to replace corner stores with healthy food options and reduce the density of alcohol within communities to reduce violent crime and health disparities.
Although much progress has been made with effort to reduce health disparities in communities, this continues to be a long-term battle. There is a need for cost-efficient solutions. With socioeconomic status remaining a major determinant of health outcomes, the increasing wealth gap needs to be addressed. Lack of access to education, employment, healthcare, and such can lead to disease. Thus, until the widening wealth gap and socioeconomic disparities are dealt with, health disparities will continue to be an issue.
For more information, the public has access to the CDC websites, fact sheets, and yearly reports, some provided by the CDC, and hospital websites. The CDC provides the public with information on what still needs improvement to combat health disparities. They also provide fact sheets and yearly reports for the public to see what has improved throughout the years and what still needs to be done to solve this problem. Many hospitals provide the public with resources they have for patients who are not able to invest in expensive healthcare. A misconception is that health disparities are differences only based on race. Health disparities can also relate to gender, ethnicity, income, education, generation, etc. Physicians and healthcare systems should let every person know that health disparities is not just about race. It involves many factors, and one should be aware of these situations.